Hello, and welcome to our video on creating a birth plan. A birth plan is a document that outlines your preferences and wishes for labor and delivery. It's an important tool that can help you communicate your needs to your healthcare provider and ensure that your birth experience is as positive and empowering as possible. In this video, we'll discuss everything you need to know about creating a birth plan, from what to include to how to communicate your wishes effectively. Understanding birth plans. First, let's talk about what a birth plan is and why it's important. A birth plan is a written document that outlines your preferences for labor and delivery, including things like pain management, medical interventions, and postpartum care. It's important because it can help you communicate your needs and desires to your healthcare provider and ensure that your birth experience is as positive and empowering as possible. What to include in your birth plan. Next, let's discuss what to include in your birth plan. Some key items to consider include your preferred birth environment, such as a hospital or birthing center, pain management options, such as epidurals or natural methods, medical interventions, such as induced labor or a C-section, and postpartum care, such as skin-to-skin contact and breastfeeding preferences. It's also important to consider any cultural or religious practices that you would like to incorporate into your birth experience. Communicating your birth plan. Once you have your birth plan drafted, it's important to communicate your wishes effectively to your healthcare provider. This can include discussing your plan with your provider during prenatal appointments, sharing a printed copy with your provider and birthing team, and bringing a copy with you to the hospital or birthing center. It's also important to be flexible and open to changes, as unexpected situations can arise during labor and delivery. Tips for creating a positive birth experience. These can include things like practicing relaxation techniques during labor, having a support person present, and being an active participant in your care. It's also important to prioritize your physical and emotional well-being, and to remember that your birth experience is unique and personal to you. Common questions about birth plans. Before we wrap up, let's address some common questions about birth plans. One question we often hear is, do I really need a birth plan? While a birth plan is not required, it can be a helpful tool for communicating your preferences and ensuring that your healthcare provider is aware of your wishes. Another question is, when should I start working on my birth plan? It's a good idea to start thinking about your birth preferences early on in pregnancy, and to finalize your plan around the 36th week of pregnancy. Here's a sample birth plan that includes some common preferences like: I prefer to give birth in a hospital/birthing center/home setting. I would like to use natural pain management techniques, such as breathing exercises, massage, and hydrotherapy, and would like to avoid medication if possible. I would like to have intermittent fetal monitoring rather than continuous monitoring, if possible. I would like to have a support person, such as a partner or doula, present during labor and delivery. I would like to avoid unnecessary medical interventions, such as induction or C-section, unless medically necessary. I plan to breastfeed and would like to have skin-to-skin contact with my baby as soon as possible after birth. I would like to delay routine procedures, such as cord clamping and baby bathing, until after the first hour of life. Thank you for watching our video on creating a birth plan. We hope you found it informative and helpful. Remember, creating a birth plan is an important step in preparing for labor and delivery. It can help you communicate your preferences and ensure that your birth experience is as positive and empowering as possible. Remember to be flexible and open to changes, and to prioritize your physical and emotional well-being throughout the process. Support this video, like, subscribe and share. Keep it here, we'll see you in the next video.